Welcome to The Data Pulse, a data-driven health podcast breaking down key health trends and insights in South Carolina. Brought to you by the South Carolina Department of Public Health. Visit dph.sc.gov/tracking. Better info, better health. Here's your host, Tony G.
Welcome to this edition of the Data Pulse. I am your partner in praise, Tony G. Today we talk with Shawn Skinner from the South Carolina Oral Health Action Network. The vision of the network is to improve the oral health status of all South Carolinians through collaborative partnerships, innovative evidence-based initiatives, oral health integration, and preventative public health strategies. They understand the connection between oral health and overall health and the importance of maintaining good oral health across the lifespan. We'll talk with Shawn Skinner after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health.
We're talking today with Shawn Skinner from the South Carolina Oral Health Action Network. How you doing today, sir?
Tony, I am excited to be here this morning. It is a great day. Nice, cool, kind of muggy day in South Carolina, but, you know, it's a good one as we're getting ready to start summer.
Man, thanks for joining us. First of all, why don't you tell us, since this is your first time with us, tell us about yourself, where you're from, and how you got into oral care.
Oh, you got a good deal. All right, so I am a San Diego native.
Wow.
And a military veteran, so a transplant to Columbia. Evidently, I love the hot weather here for some reason. I don't know why, but so that's Southern California to South Carolina. I have a master's in public health, and I got into oral health through my master's program via South University here in Columbia. And, you know, I interned with then DHEC in the section of oral health and loved it. I mean, the director there, Michael Treadway, is amazing. That team is great. A lot of energy there, and I just loved what they were doing around oral health in South Carolina. As you can imagine, public health is a huge spectrum of disciplines, but the oral health side just stuck with me and with that team. And I started there as an intern. And, you know, we had such a good time during that internship period. I stayed on for free for a bit, and then we were able to finally get something in place to be employed over here and take over the South Carolina Oral Health Action Network, which is a part of the section of oral health in DPH. And in that role, I just get a chance to go all around the state, shoving toothbrushes in the kids' mouths and talking oral health. And I love it. Every day I get to bring a lot of energy around oral health because we know it's just a huge burden of health here in South Carolina. And anybody that I can help improve their smile with a little love and encouragement, that's what I get to do. And I love every day coming to work.
I hear you, man. So today we want to touch on oral health trends, of course, here in South Carolina, health trends. And first of all, let's start with the basic question. Why is oral health important in the first place? Well,
you know, Tony, oral health is like a window into your body's health, and problems in the mouth can be signs of issues in the rest of the body, and vice versa. You know, for example, poor oral health, especially gum disease, can lead to inflammation, which is connected to heart disease, stroke, diabetes, and things of that nature. So one of our first key roles in the section of oral health in the SC Oral Health Action Network is to what we call, you know, changing the psyche. We want to flip the psyche so that we understand that the mouth is the gateway to the body, okay? And put the head back on the body, put the mouth back on it, because you go to the doctor and, you know, you're getting treated for A, B, C, and D, and they'll look in your mouth, look at everything else, but, you know, bypass your teeth and all that good stuff, and miss a lot of things that are going on there because the mouth can give you a lot of secrets about what's going on around the other parts of the body. So that's the first big takeaway. Understand that, you know, there's a connection between oral health and your overall health.
Shawn, insurance could be a major reason why people don't take care of themselves. So if people in the community don't have insurance, what are some steps that they can take to maintain good oral health?
Well, I love that question, and that's the question I get asked the most around the state. South Carolina is a state of very high levels of uninsured and underinsured across multiple disciplines. But when we're talking dental insurance, there's a perceived notion that dental insurance is just expensive and things like that. But dental insurance not as expensive. Dental procedures quite expensive. So there's a bit of play there. But if people do not have insurance, Tony, there are a lot of resources around free and low-cost dental care around the state. If there's a tech school near you, Tony, there's a high probability, 90% chance that you can go to that tech school and get some good oral care there, things of that nature. So if you don't have insurance, understand that there are mobile van units around the state to assist with folks that have transportation issues. You've got the tech schools that are offering oral health there at their campuses. And on our website, we list a lot of these resources in our oral health toolkit that's there so that people know where they can get this kind of care. There is care everywhere. Even though we have a lot of dental provider shortage areas and deserts around the state, where there's a will, there's a way. And that's what we do with the Action Network, as we action all of those methods of getting oral care to people, especially our most vulnerable in our rural areas, our elderly, our veterans, and our Latino and Hispanic population.
So give us that website.
That website, it's Scohan, SCOHAN.org. www.scohan.org is where you can find all the information that can assist you as a family, if you're a provider, if you're a teacher in a school nurse, or just love oral health like I do and like to champion oral health. Everything you need is right there in English, and a lot of the resources are in Spanish as well, because our levels of Hispanic and Latino population in our state is just blowing up very fast, and we are trying to keep our hands around that group and show them love as we grow. They grow with us as they come into the state.
Shawn Skinner from the South Carolina Oral Health Action Network. We'll talk more oral health after this.
It seems like data is everywhere these days, but is it reliable? Data from SC Tracking is both accurate and reliable. It's easy to find, easy to use, and has a guide to help you find the information you need. Visit dph.sc.gov/SC Tracks. Do you want to compare health conditions in your county to the rest of your state? SC Tracking tracks that. Maybe you're concerned about air quality where you live. SC Tracking tracks that. Or maybe you're interested in rates of different types of cancer in your county. SC Tracking tracks that too. Visit the SC Tracking website at dph.sc.gov/SC Tracks and try it out. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Welcome back to this edition of the Data Pulse. I'm your partner in praise, Tony G. We're talking with Shawn Skinner today from the South Carolina Oral Health Action Network. The vision of the network is to improve the oral health status of all South Carolinians through collaborative partnerships, innovative evidence-based initiatives, oral health integration, and preventative public health strategies. One of the things, of course, we talk about here on the Data Pulse is the data website that the state has. And something that we're going to talk about really quickly is, and you mentioned all the reasons why, clearly the South Carolina rural, that means numbers are bad, pretty much, because they're just hard to reach areas. We talked about the fact that, insurance can be a hard thing to get for some people. So what can we do in our communities to improve those numbers? Because I'm sure you can find some of those things on the data website.
You definitely can. And when we're talking about, those connections between oral health, your health of your mouth, the health of your gums, and how that is tied into, cardiovascular disease, diabetes. One thing we're hitting on heavily right now is the connection between oral health and Alzheimer's and dementia. You can imagine that your mouth and your brain are highly connected here. So it is really easy for that bacteria to travel from your mouth up into the brain and affect diabetes and Alzheimer's. And we know that population is growing at a rapid rate. So anything we can do in the mouth to maintain that is going to help the body overall. But the one thing I would say is we want to make sure that we don't ignore the mouth, and the mouth is a part of the body. Taking care of your teeth and gums is the easiest way to protect your overall health, and it is the most preventative of chronic diseases that's there. When we're looking at our children, it is 5 times cavities and dental disease, dental decay is 5 times more common in children than asthma. And you know the amount of the rates of asthmatic children that we have. So dental decay is 5 times higher than that. So this is the number one disease that's affecting our children. What we want to do in our state is make sure that we're tying in our dentists and our primary providers is really the best way that we can support oral health, and breaking down those silos between the medical and dental providers so that they are looking at a patient holistically. We are piloting programs here in South Carolina to look at that. And I will say this to you, Tony, because a lot of people don't know this. One of the things that caught me kind of off guard that I was not aware of was this whole I-95 corridor of shame thing, right? And that not only affected talking about children in schools or the schools, but talked about the children and their health in that school as well. So along that I-95 corridor, we also have the worst health outcomes as well. So what we want to do is kind of, flip that on its head so that we are breaking down those issues along that and making sure that we can improve those outcomes by having utilizing our medical providers, our dental providers, our community health workers holistically and synchronistically so that we are able to put our hands around our most vulnerable populations, and we're able to catch things like oral cancers that are on the rise when a dentist is looking in the mouth. When a doctor is looking in the mouth, they can see nutritional issues and deficiencies and other hints at what may else be going on in the body. And that's what we're trying to do. And we are working hard to change that narrative from South Carolina having this corridor of shame to, on the national stage, being able to show that South Carolina is making a difference. And we are leading the pack when it comes to oral health. With the things that the Action Network is doing and with the section of oral health they're doing. And we utilize SC tracking to help us connect the dots to those chronic diseases as well on their website. So that's what I would leave us with there.
So, Shawn, let's step back just a second because you mentioned children. So what is a recommended age for kids to actually start to have their own dentist or at least be checked by a dentist?
At the Oral Health Action Network, we believe in oral health across the lifespan. And our lifespan starts with mom, right?
Right.
So we start our oral health before, during, and after pregnancy, and we handrail that system all the way up to our seniors and our geriatric communities at the network. So when you're talking about children, one, you want to make sure that mom is getting good dental care. In our rural areas especially, there's a lot of misconceptions that when you're pregnant, you don't go to the dentist. But that is unfortunately wrong, and we want to make sure that moms are going to the dentist to make sure that they have good oral hygiene. Because again, that bacteria that could be in your mouth can go right down to the body systemically and affect the baby, right?
Right.
Number one. Number two, we want to make sure that they understand the hormonal changes that are going on in their body that affect the mouth. Moms have their teeth fall out. Moms have their teeth get loose. All these types of things that go on that if you're not aware, you don't know. So you want to make sure that, when you're pregnant, you're going to the dentist.
Gotcha. Shawn Skinner, South Carolina Oral Health Action Network. Thanks for joining us on today, man.
Hey, Tony, it was my pleasure. I enjoyed being with you guys. Make sure if you don't have a toothbrush, if you know someone that doesn't have a toothbrush and you know someone that doesn't have a dental home, reach out to us at the Action Network. I've shared our website with you and our contact information. We want to make sure that everybody in South Carolina can believe it, that people are sharing toothbrushes still in South Carolina. So if you need assistance, if anything regarding your oral health, just have questions, want to know where to go, who to see, give us a call, shoot us an email, or reach out to us on our website, www.scohom.org. Thanks, Tony.